Ever sign one of those informed consent forms?
Yeah.
Before like a medical procedure.
Right, right.
Feels kind of like a formality sometimes,
I
doesn't
don't know,
it?
you just skim it, sign on the dotted line.
Exactly. But what if we thought about informed consent differently?
Okay, I like where this is going.
Like, what if it wasn't just about the paperwork? What if it was actually a tool to give you more control over your own health?
I'm listening.
That's what we're diving into today with Dr. Aldo Santos' work.
Oh, informed consent. Always demand it, right?
You know it.
Powerful stuff. I mean, he really flips the script on how we view this whole patient-doctor thing.
So for anyone unfamiliar with his work, give us the TTL, Doctor. What's the heart of Dr. Santos' argument?
It's all about respect right from the get-go. He's adamant that every single person has this inherent dignity.
Okay, makes sense. But how does that tie into, finding a form at the doctor's office?
Because it changes the entire dynamic. You're not just an object, a case to be solved.
You're a human being.
Precisely. And your decisions about your own body, those matter.
So true informed consent means?
It means you truly get what's happening.
Not just like, I trust whatever the doctor said.
No. You understand the procedure itself. What's it called? What's it supposed to do?
What could go right? What could go wrong?
All of it. And here's the kicker. Simple language.
Ah, yes. None of that medical jargon that leaves your head spinning.
Exactly. If your mechanic was talking about your car using terms you didn't understand, would you just trust them blindly?
Heck no. I'd get a second opinion, maybe even take my car elsewhere.
Right. You have to be your own advocate, and that starts with understanding.
Now, Dr. Santos dives into these three elements of informed consent: capacity, voluntariness, and quality.
The trifecta. And these aren't just medical terms, they're your rights as a patient.
Okay, let's break them down. First up, capacity. What does that really mean?
So capacity is all about whether you're actually equipped to make the call, the decision about the procedure.
Like, are you of sound mind? Can you actually understand what's being presented to you?
Exactly. And it also considers if someone else might need to step in.
Because maybe you're not able to make those decisions for yourself.
Right. Maybe due to age, a medical condition, you name it.
Important distinction. Then there's voluntariness. I feel like this one trips people up.
Oh, for sure. Especially because pressure can be so subtle you might not even realize it's happening.
It's like you're already feeling vulnerable, you're in the doctor's office, and they're the expert.
They're recommending this thing and you feel like you should just go along with it.
Exactly. But here's the thing. Dr. Santos really hammers home. Subtle pressure is still pressure.
Absolutely. You have the right to say no.
To any medical procedure.
No matter what.
It's your body, your choice.
So important. Don't let anyone, even a doctor, rush you into a decision that you're not 100% on board with.
100%. Now, on to the last piece of the puzzle.
Yeah.
Quality.
What does quality even mean when we're talking about a consent form?
It means specifics matter. Like, a lot. The consent form shouldn't be some generic catch-all document.
Right. It needs to be about your procedure, specifically. Exactly. The risks, the benefits, any alternative treatments, what happens if you say no to treatment, all of that needs to be crystal clear and specific to you.
And if it's not,
ask. Don't be shy. It's your right to have every single question answered.
This is where it gets really practical,
Yeah.
right? Because Dr. Santos talks about this two-step process for informed consent.
Okay, so step one.
The conversation.
Yes. Your doctor should walk you through everything. All those elements we just discussed. That's gotta be covered.
But it doesn't stop there.
Nope. Step two is crucial. You get that written document.
The actual consent form.
And this is key. You read it. Don't just blindly sign.
Yeah, this isn't the time to skim. Really understand what you're agreeing to.
And don't feel pressured to decide right then and there. Take that form home.
Sleep on it.
Talk to your family, your friends, get a second opinion.
You're right, there's no rush. Now, something that really struck me while reading Dr. Santos's work is this. Signing that form, it's not like a point of no return.
Absolutely not. You can change your mind.
Even after you've signed.
Even then, up until the procedure actually starts, that consent can be withdrawn. And on the flip side, if you initially said no...
You can change your mind later and say yes.
Precisely. It's all about keeping that dialogue open and making sure you're comfortable every step of the way.
It really puts the power back in your hands. Now, one more thing I wanted to touch on, accountability. Because even with a signed form, doctors are still accountable for their actions.
That's a huge point. Signing that paper, it doesn't give a doctor a free pass.
Exactly. Like if a surgeon does something during a procedure that wasn't discussed, or there's a complication that comes up,
They're still responsible.
informed consent isn't just a one-time thing. It's an ongoing conversation throughout your healthcare journey.
Building that trust, having that open communication, that's what it's all about.
So what's the takeaway for our listeners today? What should they do with this information?
Be empowered. You have the right to find a doctor who gets this, who respects your autonomy.
Who listens to you?
Yes, and if you're not feeling heard, if things aren't clear, find someone else. It's your health, and it's worth advocating for.
That's so powerful. And it leads us to this thought-provoking question that Dr. Santos's work sparked for me. He focuses on individual rights, which is crucial. But what happens when those medical decisions impact not just one person, but a whole family?
Oh, that's interesting.
Right. Like, how does that change the dynamics of informed consent? What new challenges come into play? That's something for all of us to think about as we navigate our own healthcare journeys.
A lot to unpack there.
Definitely gives us a lot to think about.